start to actually form some judgment about the interim lessons as to how the Welsh Government has responded. And joining me tonight is Dr. Camilla, who is a GP and a public health consultant, is passionate about women, child health, gender equity, and universal healthcare. Croeso cynnes iawn, Dr. Camilla.
Diolch yn fawr.
So I thought we'd start off because it's obviously hot off the press, the most recent changes to the lockdown restrictions, which are going to be starting soon. What do you think about this latest announcement? Is the Welsh Government moving too fast, too slow in easing the lockdown restrictions, do you think?
From my perspective, I really welcome the cautious nature of the easing of lockdown that we're seeing in Wales. I think it's really appropriate, especially as we haven't got the test and trace system up and running. For the sort of easing of lockdown, we really have to know what's happening, as everyone talks about, to the R. So to do that, we need the test and trace up and running. So yeah, I really do welcome the cautious nature. I don't think that we should see anything else at this time at all. Yeah.
Yes, and there was you referred there to the famous, now famous, of course, R number, the reproduction number, and there was the scientific advice from the Welsh Government's own technical advisory cell seems to be stressing the need to take a very, very step-by-step incremental approach, and it's interesting to see some degree of divergence opening up between the approaches being followed by the different governments, and maybe that's a theme we'll return to before the end of the podcast. I'd just like to take us back. I mean, take us back right to the very beginning, I suppose, and when the outbreaks was first identified in Wuhan. Camilla, I think through your own work, you do some work with the WHO. Maybe just if you could remind us of what the WHO did right at that very beginning, around the 20th of January.
Well, the WHO right from the beginning listened to Wuhan when they raised the alarm. They sent a team to try and understand what this new pneumonia that they were seeing was caused by. And very early on, right at the end of January, they called a public health emergency. So they knew right then that this was something that countries should prepare for, and that it was important to do so. You know, Wuhan is a hub. People knew that people would have been traveling in and out of the place, and we didn't know what the transmission looked like. We didn't know if people were going to be infectious before they were symptomatic, and all of those incredibly important things which mean that we can understand how to contain a disease. So I think that WHO at the earliest opportunity raised the alarm and were transparent about what this could mean globally.
And the genome of the disease was sequenced fairly quickly, wasn't it? I mean,
yes, it was. It was sequenced very quickly, and that was shared so that countries could start to plan for their own testing. Obviously, to be able to understand what's happening with transmission of a virus like coronavirus, you need to be able to test and test rigorously within your own country setting. So that was why that step was so important.
A sort of fairly dominant theme then, didn't it? I mean, and it has pretty much remained so, the centrality of testing as a means of surveillance, but also actually suppression of the disease then through isolating cases.
Yes. Yeah, and WHO have remained incredibly steady with their messaging around testing and tracing and isolating, because at the beginning when they hoped that this could be contained, that was the way to contain it. Now, obviously, we're looking for suppression. It's the way to understand what your spread is. This is a very difficult virus to understand because there seems to be such a variety in symptoms. So there is asymptomatic spread from what we understand, but at least there is mild symptoms. So, that can lead to spread easily, and yet there's such severe disease as we've seen, and death, unfortunately. So only by testing will you really understand the epidemic that's in your context.
And I suppose that takes us to one of the more controversial elements within both the Welsh government and indeed the UK government's response to the pandemic so far, which was the decision on March the 13th. So that was a day after, I think, the date when the WHO officially declared coronavirus as a global pandemic. And they then decided, Welsh government and the UK government decided to depart from testing symptomatic cases in the community. So effectively taking a different line from the WHO. I mean, do you think that is that a central decision in working out and evaluating, I suppose, the Welsh government response?
Yes, it definitely is, and I think that it was difficult to understand the decision making behind that from a public health response point of view. At that point, there was much more rigorous community testing and contact tracing and isolation. And the minute that stopped and all the priority of testing went into secondary care, so severe cases when they presented at hospital were tested rather than the community, it was very difficult. And you could almost say that the UK government and the Welsh government were unable to really understand what was happening with the virus, and they were unable to have, therefore, a handle on it.
And I think around that time as well, we heard reference from the UK Chief Science Advisor, this concept of herd immunity, which it seemed to be the justification for this change in policy, and which the Welsh government were copying. That was later withdrawn, but has this, at times, this slightly confused messaging and a lack of transparency over the reasons and the rationale behind the policy, has that been a bit of a pattern during the last few months?
Yeah, I think so. I think as a doctor, as a public health professional, but also as a daughter and a mother and a sister, it's very hard to make the sacrifices that are being asked of you and not understand the reasoning, and also to not have transparency about decision making. If the decision, which we now understand was made, as you alluded to, around the community testing, was made due to capacity of testing reagents, rather than it was a strategic decision, that should be acknowledged openly and publicly. If testing targets aren't hit, then that also should be acknowledged publicly. I think there's a lot being asked of people, a lot of trust being asked of people who are already suffering anxiety in a very difficult situation. And I think that honesty is one thing that we can really ask from our leadership, to be able to be honest about when things have gone right and wrong. It's really important. And at the beginning, you talked about the need to understand what hasn't gone right up until now, not for blame, not for criticism, but just so that it helps us as we move forward. This is in no way the end of the story, is it? We know that we're not maybe even in the middle of the story around COVID-19. So I sort of do really call on leadership to honestly acknowledge things that haven't gone right, and talk about how that will influence how things might go forward. I do think that it'll help public engagement, and it will help with people's coping, both mentally and physically, with what's going on.
Interesting, I suppose in your world, in the clinical world, actually, medical advance depends to a large extent on this spirit of openness, both professionally and publicly. Mistakes happen. You learn from them, and you have peer review. I mean, is case notes review and clinical review is how clinical practice changes.
Exactly that. You know, as a clinician, we're really encouraged to do what's called reflective learning. Acknowledge that mistakes, as you say, are made. Often those mistakes are sort of systemic. Sometimes it's just you know, the wrong judgment at the wrong time, but people suffer because of that, and we need to learn and grow from it. And the first part is acknowledging that despite best efforts, or despite knowing what we did at the time, we did make a decision that wasn't necessarily give us the outcome we wanted.
Yeah, great. Let's turn to some of the questions that we've had in from members of the public. A lot of interest out there, as you can imagine. And so if we turn first of all to a question from John Burton from Facebook. Oh no, actually, let's do let's do John first, which is, and John's question is, why have we crashed and burnt the Welsh economy for a disease that has an overall fatality rate similar to seasonal flu? Do you feel that the house arrest for a whole population is a proportionate response rather than quarantining the vulnerable, particularly when the chances of anyone dying under the age of 55 is very, very low? And we've got a comment as well from Wendy Powell-Jones from Facebook, agreeing with John's remark and saying that she's concerned that even more deaths have happened because of the lockdown. I've really no words to express my total comprehension and bewilderment of the whole situation. How will this episode be looked back on, I wonder? So two related points in a way. How does this compare with general seasonal flu, and are we overreacting in terms of the level of mortality? And then the second point, actually, I suppose it's a quote that we had from President Trump, is the cure worse than the disease in terms of the non-COVID deaths or other negative impacts that may have been caused?
And I thank you to John and Wendy for the questions. I think they're really interesting and also incredibly helpful, because I think it shows the lack probably of good communication around what coronavirus is and the risk that it holds. I mean, one of the first sort of things when you're trying to compare coronavirus with seasonal flu is that there's no vaccine for coronavirus. So, you know, we have a vaccine for seasonal flu, and that reduces the mortality considerably. The other thing to say is that it's always hard. Case fatality rate is a very inaccurate measure, and until this is all over, people would be studying it for years to come, I would imagine. But there are estimates that it's around 3%, whereas seasonal flu is about 0.1 to 0.2%. So yes, this is much more dangerous than coronavirus. The lockdown, it's a very interesting point. I think the lockdown is around protecting others. It's not about necessarily protecting the individual. I would say that any death is too many deaths, and you know, we have seen deaths of young people as well as old people, and there's many reasons for that. And from the economic point of view, I would also say that I'm not an economist, but I do believe that the sort of long, more drawn out lockdown that we've seen probably does have longer implications. Had we locked down earlier, I believe we could have had a shorter lockdown, especially in Wales, and probably seen less deaths. But the lockdown, unfortunately, we've seen it globally, is essential in order to try and gain some control over the spread of this disease. To Wendy's point, I agree. There have been lots of non-coronavirus deaths, and I am saddened by this. And I think a lot of that was because of the decisions taken to prioritise coronavirus in NHS settings, which was needed for the capacity. But it has meant that other people have suffered. So the quicker that we can get control of the coronavirus and get back to NHS functioning and people receiving the appropriate care, the better. I'd also say, I think, on behalf of the NHS, that they are really keen to see people for any reason. However busy they are at the moment, they do want to treat people. So, people shouldn't be scared to go to their NHS hospitals and GPs for any care.
Yeah, it's interesting that some of the academics, professors of public health, etc., people like Debbie Stridhar, who've been, I think, persistent critics of the general approach taken by the UK government and to some extent the Welsh government on the WHO policy of test and trace. I think one of the points they make, as you were saying, is one of the benefits of adopting a comprehensive test and trace approach, a kind of a disease suppression approach or elimination approach, is that you can have a smaller or shorter lockdown. Yeah. And so many of those other absolutely correct points about the wider impact on people's well-being can then be minimized because you have this other toolbox. A lockdown is really an emergency brake that you should use as minimally as possible. Yes. We've got another question here from L, I think, from Twitter, asks, does Dr. Ducker have a theory as to why case rates are so much higher in RCT, Merthyr and Southeast Wales compared to Ceredigion? Is it population density? Is it testing and reporting, or are there other factors?
I think it's probably, thank you for the very interesting question to start with. I think it's probably got multiple factors to why the cases are higher in those areas. I think that deprivation, social and economic deprivation, may be some of it. We know that the fact is that in poorer areas where people have to go to work and therefore leave their homes to go to work because they can't work from home, they're going to be more exposed. There's going to be more cases. And so that could be one factor. Population density is also another factor, and also increased testing may be another factor. So I think that it's going to be a while, I'm afraid, until we have a clear answer. But I think that we'll see a lot of factors, as I say, as to why.
Yes, yeah, it's interesting, as you say, that the way in which COVID-19 has laid bare the sort of the inequalities that were already there, of course, but it's displayed them in the most stark terms possible, hasn't it? And it's true in terms of class, but it's also true, as we know, in terms of race as well, with the higher proportion of people in the BAME communities that have suffered.
Yes, no, exactly. There's a lot being said about the fact that COVID-19 knows no borders, and that's very true, but it definitely is not an equalizer. As you say, it's really amplified inequity in all its forms.
It's probably too early to give a definitive answer to these questions, as you rightly say, but it is interesting that in Ceredigion, the local authority there did persist with a kind of tracing model, despite they didn't hear the instructions or something, like they ignored them, and they just carried on. They didn't stand down their contact tracing teams within their public health team, which has actually put them in good stead now as well as we restore that policy. But it'd be interesting to see when we look back whether that may have been a factor as well. I think they also insulated their care homes, and so they completely insulated them from accepting any new entrants, etc., I believe. So it'd be an interesting case study when we have the full data.
I agree, it will be. I think that all of those policies that they continued with will no doubt show a difference in the end in their mortality and also their morbidity.
Yeah. Now we have a question from Twitter from Nelson Girl. The arguments for having the tracker app are compelling, but I'm worried about the security of it. Where is data stored? Who has access to it? Can it be used for other purposes? Can our information be sold to companies? Lots of worries about privacy surrounding the contact tracing app and how the information is stored more generally as a result of contact tracing.
Yeah, I mean, I think in this question, thank you for a very good question. I go from to being a citizen again and share those concerns too. I think that we need more information on the app before people will feel happy and confident that they want to use it. And we need people to use it, otherwise it becomes useless, really. So we need a large proportion of the population to download and use it. I think it's about 80% for it to really have the impact we need it to have. And this maybe goes back to the point we were talking about earlier about trust in authority at this time, which comes back to the transparency. So I think we need to be able to trust that this is the right thing for us as individuals.
Yes, and I suppose the same applies even without an app, even if information is being stored. Which is gathered by human contact tracing teams, but it will be stored nevertheless on a database.
Yeah.
And so people need to have absolute assurance that the very personal information about their contacts is kept 100% secure. So it goes back to the trust question that we touched on earlier. A question from Nigel Thomas Hunt from Facebook. I know that this is not a decision made by Welsh government, but could I ask what you both think about the reality that international arrivals have not been tested when entering the UK in Heathrow Airport? Furthermore, they're not given advice or guidance, leaflets, etc.
Yeah, I mean, I was very, as you said earlier, I work abroad a lot, and I came back from Mali in West Africa, where I work, in early March. When I arrived in Mali, I was met by people in hazmat suits who took my temperature and made me fill in a form. And this was nearly a month before they had any cases in Mali that they knew of. So I was quite surprised when I arrived back to Heathrow to nothing at all, and surprised that they continued with no guidance. We know the limitations of just screening for temperatures. We know that COVID-19 has variable symptoms, but at the same time, I think that we missed, there was a trick missed with not giving guidance and potentially not quarantining people when they came into the UK through Heathrow. And I would agree that it was something that was missed and is being done now, but that feels a little late.
Yes, I mean, a couple of thousand people that came in directly from Wuhan, I think, and also I suppose that later emergence of the hotspot in northern Italy, and which seemed to be the main mechanism whereby community transmission was seeded. To be interesting to what was there any thought given about at least contact tracing with a focus on people that had been, including people in Wales, of course, who had been in northern Italy during this period?
Yes, exactly. it feels like, again, it would be nice to know the decision process behind the sort of non-decision to do anything actively at Heathrow. Yeah, I agree.
A final question from members of the public. Adrian Thomas on Facebook is asking this. I live in Herefordshire on the border of South Wales, close to Hay-on-Wye. Fantastic digital festival. Been going on all week. My fiance lives in Rhyl, 123 miles away. Having not seen her since the beginning of March, 3 months to date, can you advise me of any changes that would allow me to travel to see her and stay over for a week or so? An understandable question, I think we'd have to say. I suppose it's in a category of the great sacrifices that many people have made in order to keep others safe, really, isn't it?
Exactly. You know, I want to send my sympathies. I have the majority of my family a long way away, and don't know when I'll next see them. So I think it's a huge. People have made huge sacrifices. They've suffered grief in a very difficult and distant way. They've managing, you know, children whilst working, not seeing loved ones. I mean, I think it's been a very difficult time, and it's not just about the individual. It's about protecting vulnerable people within our society and protecting the NHS from becoming overwhelmed. And I think as time goes on, you know, it is hard and it takes its toll on us.
And really, and you know, total understanding and sympathy with Adrian's position, obviously, and everyone else. We've all got our own stories to tell here. It's breaking my mother and father's hearts not to see their grandchild, and that is being repeated in every you know, in every household in different ways in Wales and further afield. But the prize, of course, is that we don't have to. If we learn from some of the mistakes that we referred to earlier, then we should have some hope of avoiding what would be a cataclysm, which is a second wave or a third wave, which would mean that we'd have to then reimpose the lockdown with all of the suffering that would entail. Which would, I think, be the worst outcome of all, wouldn't it, Camilla?
I definitely think so. I think we need to, you know, we need to see the long-term goals. And you're right that if we can stay resilient now and carefully ease lockdown with a really sort of vigilant eye on what's happening and the R number, then we can reap the rewards in the next few months. But I think that we do have a huge risk of going into a second wave, as people have talked about in the autumn, that hits with seasonal flu and all of the other viruses of the autumn and the winter, would be catastrophic, and there has been too much loss of life already. So I think that it's really hard, and there needs to be a real recognition of what people have suffered, and how people have really come together as a community for the greater good. So I think that if we can sort of, as you know, keep strong, then we will definitely reap the rewards, I hope.
And just to finish on this, really, because while I think it's right, I think to point out some pretty central mistakes that I think may have been made, where policy moves in a better direction. I think it's important to acknowledge that as well. And there has seemingly been a greater preparedness by the Welsh Government to start to follow its own line, and to certainly, it would seem to me anyway, to adopt a more cautious approach than possibly is being adopted by the UK government as we begin to ease restrictions. I welcome that, Camilla. What's your view?
I welcome it also. I think that the Welsh government's divergence from England has been nothing but positive when they've started to do it. We're now seeing this caution. We're seeing their prioritization of a test and trace system, which I look forward to. So I think that I would, I would, as you say, congratulate them on doing it. I think now they're making decisions that are best for the population of Wales, and that's really heartening to see.
I think that's a really good note on us to end the conversation, Camilla. I've really enjoyed. Thank you for your time, and thank you for everything that you're doing, and all of the health and care workers throughout the length and breadth of Wales.